one child a day dies of this. Why do we not have more research? Like, where are those gaps in understanding that research hasn't been able to answer so far?
Yeah, so certainly we are doing a lot of research in this area, both to understand why human milk, breast milk, is so protective to babies, and to understand what other things we can do to help prevent NEC.
Would you say it's safe to say that the reason Black babies are dying more often from NEC is not because of some biological reason, but more so the circumstances of mother?
So it's certainly a complex question. We know that race is a social construct and not a biological construct. And so we really need to better understand what about the social construct of race, exposure to a structural racism, and things along those lines ultimately change the health outcomes of our babies.
We have done a lot of stories at 11 Alive with mothers and about racial disparities, not only with NEC now, this is the first time we're doing this story, but with mortality rates and things like that, especially in Georgia. We have a lot of hospitals that are in rural areas. I mean, is it an interesting area to look at when we're talking about the expense of donor breast milk and the areas that are less likely to have access to those things?
I think certainly we do need more understanding of what the rates are in different areas of Georgia, and it's part of my ongoing research to better understand disparities in infant mortality within our state. I think it's also really important to go to those communities that are facing those issues and understand from them what the problems they're facing are and what solutions they might propose. Because people that are living in those areas that have these outcomes, they're the ones that best know kind of what their problems are and how to fix it.
Why is that so important in finding answers?
Yeah, so I think that, while we have the data and the numbers, that doesn't always tell the whole story. Certainly there are individual reasons for each mother or family as to what has gone on in their life. What factors may have predisposed them to deliver a baby prematurely, and then additionally what other factors are maybe perhaps preventing them from providing breast milk. And so it's really important to recognize that while we have numbers, the numbers don't always tell the whole story, and that the solutions for a lot of these problems can be found by just going to the source directly.